Welcome, Dr. Shah. I really appreciate you coming and spending some time and explaining to us a little bit about what you do. So we'll just jump right off. You're a naturopathic physician. Could you explain to us
Correct.
exactly what that is?
Yes. Naturopathic doctor is one that studies Western medicine as well as Eastern medicine. So our training is 4 years of medical school. The first 2 years are mostly anatomy, physiology, biochemistry, pharmacology, the basic medical sciences, and then the last 3 years with the second year overlapping is natural medicine, so herbs, nutrition, homeopathy, and other natural modalities.
Okay. So I hear you use a couple of different words, and I've heard those words before. But while I have you here, I would like to really get a good understanding about it. You talk about Eastern and Western medicine. Could you give me an idea about really what the difference is between the two, or maybe there aren't any differences, or that as many as we think?
Sure. The first difference would be the philosophy behind it. So, Eastern medicine looks at the individual as a whole person, mind, body, and spirit. Western medicine, which is more so the conventional medicine that we normally think of when we say doctor, um, is is more of looking at the person and trying to figure out the disease. So Western medicine is more detailed. It's more focused on trying to figure out what exactly is happening in the body in terms of what is the disease process, what is the diagnosis, and with that takes the next step is a treatment, which is usually the same for each person. So if someone has hypertension, the treatment is always a diuretic, ACE inhibitor, and so on and so forth. So treatments are not individualized, whereas when you look at Eastern medicine, you can have a numerous number of herbs that all treat hypertension, but for each individual, it'll be different based on their energetics, based on if it's related to stress, if it's related to diet, if it's related to emotional trauma. Every treatment is going to have to be different based on what that individual is as a whole person.
So it sounds to me that it's the naturopathic approach is to take the best of both worlds. It seems that you're suggesting that the Western approach is great at diagnosis, finding out what the issue is, mapping out the what's happening, but then the Eastern can really come and provide a custom approach to addressing the issues discovered by the diagnosis. Is that kind of
Absolutely.
how it's working?
Exactly.